Michal Kurlaender. I'm a professor of education at UC Davis in the School of Education and also lead researcher of Wheelhouse, the Center for Community College Leadership and Research. Part of the project is we're partnering with the California Community College Chancellor's Office and Public Policy Institute of California to survey institutions across our state, and as part of the national effort to understand how community colleges use recovery dollars in addressing student needs and in re-engaging students to come back on campus or to come back to being students. And so we're going to be surveying campuses, campus leaders across the state, and then we hope to better understand whether those different types of recovery activities and innovations, how they correlate with student outcomes, both re-engagement, persistence, and degree completion and transfer. The next part of our work is to look more deeply at a few particular innovations at recovery efforts. One is supplemental aid. We know that the federal government and other state supports and even local supports aim to try to get more students aid to stay in school or to be able to take on more classes. And so one of the goals of the project is to understand how different amounts, different eligibility rules may have impacted students' decision to persist or to come back to school or to start school as community college students in this pandemic period and beyond. And then finally, we'll also be looking at innovations happening across community colleges, including shorter-term courses, stackable courses, late start, efforts to remove student debt. We will have a continuous improvement effort. That is, Wheelhouse brings community college leaders, primarily CEOs and presidents and superintendent presidents, to UC Davis for institutes. And as part of that work, we've established a research collaboration council to help us understand the kinds of innovations happening across community college campuses, and then support them in their effort to understand whether those recovery activities have worked and for whom. So a big goal is to better understand how to support subgroups where we see bigger declines in persistence and even in re-enrollment. And so part of the effort is to learn from across this massive system and be able to produce some evidence on what recovery activities actually mattered.